A very warm welcome to all from the Atal Bihari Institute of Medical Sciences and Dr. Ram Manohar Lohia Hospital from the Medical Education Technology Division. So we are happy to bring you to our continuing with our workshop on research methodology. So today we talk about biostatistics, the tests of significance and inference taken by Dr. Nitin Sinha, who is a professor in the Department of Medicine and a very keen researcher. So I welcome Dr. Nitin and I request you to start with your presentation. Thank you.
It is the last part because what happens is this part comes when the entire study is complete. Now, what I mean by complete is that all the things, all the data has been accumulated, the data has been entered, and now finally the researcher decides what was my plan of action which I had thought about when the study was started, and now when I have the data, how do I go about it and how do I fulfill what I was trying to do. So that is where the test of significance come, and then finally when he applies the test, how does he take out an inference out of it so that the study reaches a logical conclusion. So starting with it, as I just said, these tests are to be applied once the data is absolutely ready. Now, it is very important for us to understand that the test of significance depend upon the research question that was there, that was initially formulated when the study was being conducted, when the study was being planned, that is when the protocol was being written. What was the hypothesis? What were the aims and objectives? So these all, they will determine what sort of significance test will be applied to the study. So these tests actually test the hypothesis and help to find out whether the null hypothesis which was taken, is it accepted or is it rejected. That is the whole purpose of these tests of significance, and whatever inference you draw is to either accept the null hypothesis or to reject the null hypothesis. So before I go on to the individual tests of significance, what I will try and do is I will try to give a gist of certain important terminologies which come across when somebody is trying to apply the test of significance. The first thing which comes to the mind is what is significance. Now, suppose there is a study which is done and there are two groups. One group is group 1, one is group 2, and the group 1, the mean is 12.6, and for the group 2, the mean is 10.9. Now, these two groups are from a population. Suppose you may say that they are from a building, they are from a society which has two buildings, Tower 1 and Tower 2. We are trying to find out whether the mean hemoglobin of person in Tower 1 is almost comparable to the hemoglobin in Tower 2 or not. So the researcher does a study, he collects the samples, measures the hemoglobin, and finally he has around huge data with him, and he tries to find out the comparison of the two groups. So what he has to do first is that he has to find out a mean. So the mean of group 1 and mean of group 2. Now you can see that it is very obvious that the mean of group 1 is higher. It is 12.6. But does that actually mean that the mean of group 1 is actually higher than the mean of group 2? Or is it just that this difference is occurring just by chance? So it is nature. Many of the parameters, they tend to vary. So we have to keep everything in mind, and before we reach to a conclusion that no, the hemoglobin in group 2 or the building or the tower 2 is much less than what is in group 1, we need to apply the test of significance. Whether this difference which we are observing, is it actually significant difference or is it just by chance? So these two terms must be very clear, that whenever we are measuring, whatever we are measuring and we are comparing, we should think whether this difference which is occurring is just by chance, and if it is just by chance, the null hypothesis is accepted most of the time, and if it is occurring not by chance, then the null hypothesis stands rejected. So when we are trying to do this, we try to fix a level. I will just come to that in the next slide. So that level, that is around 5%. This is the most common level which we said. This is 5%, that is called level of significance. I will just tell you in the next slide that what is this level of significance and all. But important point here is that the level of significance and the power of the study, it has to be fixed before the analysis is done. Rather, it is to be fixed at the time when the study is being conceptualized. When you are writing the protocol, then only it should be there. There is a column in the protocol where it says statistical methods. So that statistical method, actually you should be writing what is the level of significance that you are going to take in your study when you do the final analysis, and then what is the power of the study which is being considered. This has to be there beforehand. Then only we can proceed to the test of significance. Coming to the next and the most important thing, which mostly puzzles many people, and actually many people fantasize about it, is the p-value. Now just go back to the previous slide, the level of significance. Now what is a p-value? Now suppose there is a population, and in this population we have around 10 samples. So 10 samples, maybe one sample is of 50, one sample is of 40, one is of 30, one is of 55. So there are 10 samples, and if we take out mean, suppose we are measuring hemoglobin, and if we take out the mean of these 10 samples for hemoglobin, and if we plot them, most of the times it follows a normal distribution curve. So this is the population mean. The mean in the center is called the population mean, the mean of the entire population which you are considering, not of the 10 individual samples. So if you plot the 10 individual samples means and you form a graph or a curve, this is called as the normal standard distribution curve. Since it's a biological variable, hemoglobin, most of the times it will follow a Gaussian distribution or this normal curve. Now look at this value. What happens is, suppose I have an 11th sample. Now all these 10 means are here, but I take out a sample and I measure the hemoglobin, and it gives me a value, the mean value. But that mean value is coming somewhere here, not in this area. Now the chance that if you draw a sample, now I'm repeating myself, and that if you draw a sample and if you find out a particular variable which was of interest in your study, and you calculate that value, the probability that the mean of that particular variable will fall in this area or this area is called as the p-value. So p is called as the probability value. The probability, suppose if I've taken the 11th sample, the probability of the mean of hemoglobin of that 11th sample, will it be falling in this area or this area, is called as the p-value. Now if it is less than this, that is less than 5%, because 95% of the observations are mostly here, so it is actually, if this less than 5%, if it is coming, then we call it is that this mean is significantly different from the other 10 means. So if the sample 11 sample, if I take out a mean hemoglobin and if it is coming in this area, the probability, then I can safely say that no, this 11th sample mean is statistically different from the mean hemoglobin which I have observed in rest of the 10 samples. However, if the probability found of the mean is here, then I say no, this difference was just by chance from the other 10. There is no statistical significance between the means. So this point has to be very clear to all the researchers, that what is p-value and how do we interpret a p-value. Now another term which is used very commonly is confidence interval. Now what is a confidence interval? Suppose that in many of the journals or many of the articles, you will find that it is written p is equal to 0.04, and in bracket they have written this interval. This is called as the confidence interval. Now what is meant by a confidence interval? It just means that if this sort of a study which is under consideration is conducted on a similar population with similar inclusion exclusion criteria, with almost similar level of significance and almost similar sample size, 95% of the times the p-value will fall within this range. This is what is called as the confidence interval. So confidence interval just it gives a range of p-values. So nowadays in most of the journals, in most of the esteemed journals, you will find that they are not going about one value called as the p-value. They say, okay, you give us a range of p-values in which this will fall. So you will see that if this is significant, in confidence interval also, whatever p-values are coming in this range, they are also of significance. So it just strengthens whatever you have done as analysis. This is what is confidence interval. Coming to the next aspect is power of a study. Now there are two hypotheses. We all know these two hypotheses are null and alternate hypothesis. So if we have a null hypothesis, which means the mean of sample 1 is equal to mean of sample 2. Then there is an alternate hypothesis which says no, the mean of sample 1 is not same as mean of sample 2. Now we are not committing here whether this mean of sample 1 is more than sample 2 or less than sample 2. We are just saying it is different. This is called alternate. So if suppose there is actually a difference between the mean of sample 1 and sample 2, there is actually a difference. The probability that a study will detect this difference is the power. So if there is actually a difference, how much is the strength in the study that it will detect this difference? That is called power. So you can very well say it is just equivalent to specificity. If we talk in terms of that diagnostic test thing, it is just equivalent to specificity. So if there is a difference, that is if you are rejecting the null hypothesis, because null hypothesis says the means of the two sample is same. But here what is happening is if we are rejecting the null hypothesis, that we know that there is a difference between the two. Now will this study be able to detect this difference? That is called as the power of the study. Now in most of the situations we keep it as 80%. Now, if we can increase the power, suppose if some researcher says, no, I want to increase the power, I will keep it at 90%. So whenever he tries to keep it at 90%, he will have to calculate a sample size to start the study. That sample size will increase. So in order to make a study much more powerful, you will have to analyze more number of people. So that is what is the power of a study. So this actually comes into play when we are calculating the sample size at the time of protocol writing. This much sample size, minimum sample size I will do in my study. So at that point of time, if somebody has done a research, you will realize that power of a study is always asked whenever you're using softwares or mathematical calculations to use sample size. Power of the study is a very important factor which is asked. Now some other terms which I would like to tell you before we jump on to the test of significance. We must know what is the variable under consideration. So please try and figure out whether your variable is qualitative or quantitative. If it is hemoglobin, it is quantitative. If it is age, it is quantitative. If it is diabetes, it is yes, no. That it becomes qualitative. So what is the variable which you are trying to assess? What is the variable? What is your interest of study? So whether that thing is qualitative or quantitative, that is also important. That will also govern the type of test of significance which you would like to use. Coming to independent groups and paired groups. Now this is a very important term. Now consider what is an independent groups. Now here one subject of the study is only in one group and is not present in the other group. Now here what I am trying to say is just the first example which I gave of two buildings, hemoglobin of building 1 and hemoglobin of building 2. Now the person who is residing in building 1 cannot be in building 2. So that means the group of subjects in building 1 are independent of the group of subjects in building 2. So one subject is not being repeated into the other group. This is called independent group. Now coming to the paired group. Now paired group just means that the same subject is assessed as different points in the study. Suppose if a researcher wants that he wants to calculate or he wants to know the effect of giving iron on hemoglobin. He has a baseline hemoglobin of the patient, suppose at before the start of iron, and then he wants to calculate the rise in hemoglobin after giving 1 month of iron therapy, and he wants to calculate the hemoglobin at 10th day of therapy, 20th day of therapy, and 30th day of therapy. So what will he do? He will call the patient on 10th day, 20th day, and 30th day. The same patient sample will be taken. So patient number 1 at baseline, then at 10th day, then at 20th day, then at 30th day. So the same person sample is being repeated. This is called paired group. So here there will be 4 groups. When he will be analyzing the example which I am telling, the researcher will be analyzing, he will have 4 groups. One at baseline, one at 10th day, one at 20th day, one at 30th day. But it is the same patient whose 4 samples are being taken. This is called paired group. So they are not independent. It is the same person who is being analyzed at different points of time in the study. Now, one of the most important concepts which guides towards test of significance is normality. Now, I think two of the biostatistics lectures which have been taken before this lecture, somebody must have covered normality. But I am trying to highlight few points about normality before we jump to the test of significance. Normality is basically done for quantifiable variable. Look at this variable thing. What is your interest of study? Whether you are measuring hemoglobin, albumin, whatever the thing is, what is the point of consideration in your study? If it is quantitative, then it is called normality. Then normality comes into picture. Now, normality, what does it tell? It just tells that suppose if you have collected, or the researcher has collected 100 hemoglobin samples, it will tell whether these 100 values are distributed normally or they are distributed not normally. Normally means normal Gaussian curve, or are these values not following the normal Gaussian curve? This is what normality tells. And why is it important? Because if the values are following a normal distribution, then there are certain tests of significance which can be applied, and there are certain which cannot be applied, which we'll just discuss in subsequent slides. But for you, it must be known. But how to check normality? A researcher can ask, how can we check normality? So there are certain methods. There are graphical methods to check normality. Then there is skewness, kurtosis, and then most importantly, there are normality tests. These tests like Shapiroville, Kolmogorov-Smirnov, Anderson-Darling, Lilliefors tests are used. Now, Shapiroville test, if it is used for samples which are around 50 to 100. But for very large sample sizes, you can go for Kolmogorov-Smirnov and even Shapiroville. So these tests, if the researcher is using any software or the biostatistician is using software, these tests are done, and then it is realized whether the set of values is following a normal curve or not. Once it is certain that the set of normal curve is following a normal distribution, then we can jump onto a particular set of test of significance. Or if they are not following a normal distribution, then we have to jump to some other test of significance. So this is very important. Now, in concept of normality, there are many school of thoughts. So these tests are definitely the one of the best measures to check normality. But some people say that if the sample size is more than 50, you can assume that the data is normal. Somewhere you will find that if it is more than 100, you can assume data to be normal. But from my point of view, I will always advise that go for a test. Check whether this distribution of a particular variable is normal or not. Then decide to go for the test. Now coming to one of the concepts called as one-tailed versus two-tailed tests. Now, what is a one-tail and what is a two-tail? So what I'm trying to do is that this is just the normal Gaussian curve, which I had shown in one of the slides earlier, the normal Gaussian curve. This is the central mean value. And what you are trying to see here is that normally these two areas, no, these are called as the values which are occurring beyond chance. So if it is 5%, then it is said that 2.5 is here and 2.5 is here. If it is occurring just, on one side we take, it is called 5%. Now where we use one-tail test and where we use a two-tail test. Suppose if there is a manufacturer who has produced a new drug. Now he already knows that there is another drug in the market which is doing quite a good job and people are getting recovered from it and everything. But he finds that his drug cost of manufacturing is cheaper than that drug. So what he wants to do, he just wants to show that his drug is as effective as the standard drug. He does not want to prove that my drug is superior to the already existing drug. He is not bothered, because even if he shows that the drug is equally effective than the first drug, his job is done because his drug is cheaper, so it will be purchased more. So he will decide to do just one tail test because he is not conceptualizing the idea that his drug can be inferior or superior to the drug. He has just one idea in his mind. It should be as equal to the first drug, which is called as an equivalence trial. But I'm not going to that. So he has just one idea that my drug should be as effective, as equal as the old drug in the market. So since there is only one idea, it is called one tail test. Now coming to the second, he now realizes no, his new drug is doing much more better for the patient as compared to the first drug. So he has to prove that his drug is a superior drug to the first drug. But is it superior? It can turn out to be inferior also. So if he has to check whether his drug is better than the first, then the result can be better, result can be non-better also. So when there is a dilemma, then we use a two-tail test. So if there is clarity that my idea is going towards one direction, it is called one tail test. And if it is a, whatever you are measuring in a population, it can be good, it can be bad. Then, and if you're comparing between the two groups, you might not know whether this variable will be same as the in between the two groups, or in one group it will be higher, or in one group it will be lower. Then you have to use a two-tail test. So after dealing with all these terms, significance, power, confidence interval, p-value, one-tail, two-tail, normality, once you are clear with all these concepts and once you are ready, then we jump on to the test of significance. Now we can, as I have already told you, we can divide the test for significance into test for quantitative variables and test for qualitative variables. Now, once we are talking about quantitative variables, then we can divide these tests into parametric tests, which compare the means between the groups, and non-parametric tests, which compare the mean ranks or the median. Now, important point is, as I told you when I was discussing normality, that parametric tests are to be applied only if the variable is normally distributed in each group, and non-parametric test is to be applied if there is non-normal distribution in any of the groups or all the groups. So once this concept is clear, there are certain names of the test and I have written certain examples. Now what I will try to do in my next slides is that I will be showing you certain studies and how to approach a test for significance. Now coming to study number 1, there is a researcher who decides to check serum magnesium levels in patients in a medical ICU, and he decides to check its association with mortality. A very common sort of a study in critical care, albumin, magnesium, something or the other for checking mortality. So now, as I told you, and now what I'm trying to do is whatever I have told you in my lecture before this slide, I'm trying to now consolidate it into this practical aspect. So the level of confidence is 95. That is significance become 5%. So it is preset. Power is 80%. It is preset. Now, what is the variable under consideration? It is the magnesium level. So finally, when this researcher will get a data, he will have two groups. One, those who are survivors, and one, those who are non-survivors. And he will have magnesium levels in survivor group versus magnesium level in the non-survivor group. This is what finally he is going to get. He might be having age, he might be having gender and other things. But what was his commitment as the primary goal? To check magnesium levels between the two groups. So we'll concentrate on that. So now he will have two groups, survivor, non-survivor. And he has to check magnesium level, which is a quantitative variable. You can measure magnesium level in the serum or the blood. It is not a qualitative variable, yes or no. Magnesium will be there and there will be a definite value to it in a particular unit, milligram per deciliter. Now, realize this thing that a patient can be in only one group here. One who is surviving cannot have mortality, and one who is having mortality cannot become a survivor. So they are two independent group of patients. So we have two independent groups and we have a quantifiable variable. So we need to check the normality. Now, once we are checking the normality, we have to check in both the groups, survivor group, magnesium in survivor group, magnesium in non-survivor group. And if it is normal then or non-normal, that will decide the type of test of significance. Now, whether we will use a one-tailed test here or a two-tailed test, we will use a two-tailed test. Why? Because we don't know whether the magnesium levels in our study will be same as that of the between the two groups, survivor, non-survivor. Will the survivors have higher magnesium as compared to the non-survivor? Or will the non-survivors have higher magnesium level as compared to survivors? We cannot interpret this before the study is completed. So it has to be a two-tailed test. It cannot be a one-tailed test. If you apply a one-tailed test, then it is going to be wrong. The interpretations are going to go haywire. So finally, after everything, normality and all, if the magnesium levels are normally distributed in both the groups, survivor and non-survivor, we will use an independent sample t-test, which we normally call it the student t-test. If the values of magnesium are not normally distributed in either of the group, survivor, non-survivor, or in both the groups, then we will use what is called as the Mann-Whitney U test, which is a non-parametric test. So just going back to the table, we had this situation in this study: two independent samples, survivor, non-survivors. If magnesium was following normal distribution, independent sample t-test. If magnesium was not following normal distribution in either group or both the groups, we have to use a Mann-Whitney U test, which is a non-parametric test. So that is how you have to decide which test of significance we have to use. Coming to this, we will go to another study. Serum albumin levels in different severities of COVID-19. Now again, we will fix the level of confidence, power. We know variable under consideration is we are comparing albumin in different severity grades of COVID-19. So it is what is under consideration is serum albumin, which is a quantitative variable. So we all know from COVID-19 that there are three severity groups in COVID: mild, moderate, severe, based on the oxygen saturation. So whatever the patient will be taken, either this patient will be mild, moderate, or severe, based on the SpO2 at presentation. So a patient can only be in one group. Either the patient will be mild, moderate, or severe. It is not that the patient is mild, again from next day it is jumping to moderate. No. Since this classification is based only on SpO2 at presentation, the patient is classified as mild, moderate, and severe based on that. So if each patient will be in just one group, this patient cannot jump to another group in analysis. So there are now three independent groups. In my previous example, there were two independent groups. Now we have three independent groups. Now we have to check normality of albumin values in all the three groups. So once the data is ready on the master chart, this researcher will have three groups: albumin in mild group, albumin in moderate group, albumin in severe group. So he has to check normality in all because it's a quantifiable variable. And then again, he will have to use a two-tailed test. Now it should be beyond doubt that why he should use a two-tailed test. Now, if the albumin levels are normally distributed in each group, mild, moderate, severe, then he has to use one-way ANOVA. But if the albumin levels are not normally distributed in either of the group or in all the three groups, then he has to use Kruskal-Wallis H test. So that is how an approach to a significance test has to be done. Now, since there are more than two groups now, in the previous example, it was very simple: magnesium level between survivor and non-survivor. But now here it's a problem because now there are three groups. So suppose one-way ANOVA is applied. This researcher decides to do one-way ANOVA. He gets a p-value which is less than 0.05. That means that the albumin levels is significantly different between the three groups: mild, moderate, and severe. Now, but between which three? But between which groups? Is it between mild, moderate, moderate, severe, or severe, mild, or all the three? We don't know. This p-value is one value. So how is researcher going to interpret whether this significance is between which groups? So there, what we talk about is post hoc analysis. Now, there is a proper mathematical method to calculate it, and in software it is done. You have to select with one-way ANOVA post hoc analysis, and post hoc analysis gives that thing that in between which groups is this difference significant, which will give more meaning to the study which the researcher is doing. Maybe the difference or significant difference was only between mild and severe, Between mild and moderate, there was not much of a difference. Between moderate and severe, there was no significant difference. But yes, between mild and moderate, severe, there is a difference. I will discuss the third example, systolic blood pressure in patient with anxiety and response to abdomen treatment. So now just concentrate here on the one thing. It is a systolic blood pressure, which is a quantitative variable again. Now here, look at the true groups, pre-treatment and post-treatment. Now here the researcher decides he will measure the blood pressure at baseline, and finally he will give a drug to anxiety patients, abdomen, and after around 20 days, he will again check the blood pressure. So this same patient who was on day 1 will be called on day 20 to check the blood pressure after he has taken the drug. So this becomes a paired group. It is not an independent sample. Same patient is being, monitored for 20 days, and after 20 days, another blood pressure reading is there. So this is paired sample. We have discussed independent sample. Now this is paired sample. Now normality, we have to check in both the groups, the researcher. And finally, if it is normally distributed, he has to use a paired t-test. And if it is not normally distributed, he has to use Wilcoxon signed rank test. Now coming to the statistical test to compare qualitative variable in which you cannot measure. It is yes, no, mild, moderate, severe. So either it is ordinal or it is nominal. So this is called qualitative. So again, I have put in a table. So I will just give one example for this also. Now it is prevalence of low birth weight in Kandopur village and association of economic status with this low birth weight. So here the variable is low birth weight. This is a qualitative variable, but a low birth weight is there or not. And it is based upon measurement only, but we are not putting that measurement here. We have to classify that into low birth weight, yes or no. And it is to be seen whether this low birth weight is associated with the economic status or not. So how are you going to assess it? You are going to draw a 2x2 table. This is called as the 2x2 table. Now low birth weight, normal weight. Low socioeconomic, high socioeconomic. That is how. So some patient will be in A, some patient will be B, some patient will be C, some will be D. This is a normal 2x2 table. And this is called as the observed value. This is what the researcher gets. This is called the EV is called as the expected value, which is to be calculated for each cell. This cell, this cell, this cell, and this cell. And how is it calculated? Row total divided by column total divided by the total number of subjects enrolled in the study. So why is it done? Because if the expected value in any of the 4 cells, is less than 5, we have to use Fisher exact test to check association. And if it is more than 5 in all the 4 cells, we have to use Pearson chi-square test to check association. Now coming to the inference part. Now this step comes after the suitable test of significance has been applied. Researcher knows which test to be applied, and now he has applied this test. Now he has to see whether what result is coming out of that test. Now either the researcher can use normal logical mathematical formula of the test and all, or he can use software. And finally he has to decide whether whatever difference he is getting is by chance or is it significance. Now whenever he applies a test statistic is calculated. So whatever test he is applying, whether it is ANOVA, whether it is Wilcoxon or something, a particular value will come out after applying this formula. That is called as the test statistic. Now, as I told you in the very initial part of my lecture, he has to take this test statistic and he has to check the probability of getting this test statistic checked. This checking of probability, what is the probability? That will give the p-value. Now, if the probability is less than 0.5, he will term this difference as significant. That is how he will derive an inference. Now, I will tell you an example. This is just an example of serum albumin levels among patients of sepsis of different patients who die or survive in a tertiary care hospital. Level of significance is 5, power is 80%, albumin is a quantifiable variable, and there are 2 independent groups, survivor and non-survivors. Serum albumin needs to be checked and recorded for the 2 groups, and normality is to be checked. So this is just a revision of what we have talked about in the initial part of the lecture. Now finally the researcher gets mean albumin of survivor, which are 12 in number, as 3.2, and mean albumin of non-survivor, which are 20 to be 2.7. Now is this difference statistically different or not? So he checks normality And now he has to check whether this difference is by chance or not. Now, if it is normally distributed, he decides to go for the independent sample t-test. Now he is using the mathematical calculation. He is using the formula. So with the formula, he gets a value of 2.48. Then there is a term called as degree of freedom. So he has to check that degree of freedom, and he has to check the probability in this chart of t table. Now look at the total sample size is 32 minus 2 is called degree of freedom. So 30 is the degree of freedom, and look at this value 2.45. So this is the value he's getting 2.48. This is the closest value he's getting 2.45. And look at the probability of getting this value, it is 0.02. This is the p value. This is called as the p. The probability of getting the value which he is getting in a test, in the test which he has applied, is called as the p value. So it is 2%. That means the difference which he has got in these albumin values is statistically significant. Now, nowadays, this is the era of softwares. So with the advent of software, there is no need to indulge in remembering formulas and lengthy calculations. And there are different kind of softwares available. The basic is Excel, then SPSS, then R Commander. Actually, G Power is more for sample size. It is not for all the statistical calculation, but R Commander, SPSS, and Excel are commonly used. So coming to the end of my lecture, if we have to do a test of significance, the level of confidence or significance power has to be decided in the beginning. Normality has to be checked for quantifiable data. Appropriate test of significance has to be applied based on study design, and correct interpretation has to be taken out. I will dedicate this talk to one of my friends, and he's actually my teacher, Dr. Prabhakar Mishra, who is in Department of Biostatistics and Health Information in SDPGI Lucknow. Thank you.
Thank you, Dr. Nitin. That was actually a masterclass. And I'm sure that whoever watches this will gain a lot and feel confident to do all this analysis, if possible, or by themselves. So we have time for a few quick questions. Dr. Raghav.
Good afternoon, sir. That was a very elaborate lecture. I have a few questions, sir. One is when we're talking about non-parametric and parametric tests, how are the parametric tests superior to non-parametric tests?
Okay. See, the basic difference between the two tests is power. Now, this is not power of the study. This is power of the test, which I'm talking about. So there is a different. This is actually calculated mathematically. So parametric tests have more power as compared to non-parametric tests. Now, suppose if there is an existing difference which is to be taken out in the study, we know that there is some difference. So the power to pick that difference out is more with the parametric test than non-parametric. Now, one thing I would like to highlight here is that though it is very easy to say that if it is not normally distributed, we should use a non-parametric test. But we should try as a researcher and as a biostatistician to convert the non-normal data to normal. So it can be converted by means of logarithm. So many of the biostatisticians, they try to convert the non-normal data to a normal data by the help using a logarithmic scale, so that they can apply what they call as the parametric test, because they have more power. So, but on the other side, non-parametric tests have an advantage that they can even compare ordinal data and median, which the parametric test cannot. They can only compare means. So they both have their pros and cons, but if you talk about power in terms of mathematics, then parametric tests have much more power than non-parametric tests.
Okay, thank you, Dr. Nitin. So I just want to add, we talked about the sample size. If we can take a rough value of 50 and we should be safe. So I wanted to add that though we can assume with a large sample size that the data would be normal and it could be used for a parametric test, there's also the effect of the effect size. If the effect size of the study is large enough as compared to previous data, that also ensures application of parametric tests. So the calculation of sample size is a different topic, but there are these two parameters which are very important. So if you feel that your study will contribute significantly to the effect size, that you will have a large difference between the populations studied, then also the sample size could be reasonably managed.
Yes.
Dr. Raghav or Dr. Himanshu, any other questions?
Sir, while talking about level of significance and confidence interval, sir, like can we increase the confidence interval, say like 95 to 99, and also the level of significance from 95% to 99%, sir?
Okay, that's a very good question, Dr. Raghav, because see, now this actually comes to type 1 error. So what you are trying to do is, now I don't have the slides right now, but thing is, if we just go by the normal distribution curve, now we have set a limit as 5%, that any mean, suppose we are calculating means, if any mean of a population is coming, probability of that mean coming in the normal range to coming in that extreme range is less than 5%, then we call it as a significant thing. Now assume that we keep it as 1%. So whatever probability which is coming like 0.03, 0.04, though if we have kept it at 5%, they all will be taken as significant. But if we are keeping it at 1%, then unless and until the probability is less than 1% of getting that difference, it will all be called as occurring by chance. So the problem is, if we keep it at 1%, the sample size is going to increase. Now, because this level of significance has to be there when we calculate sample size. So statistics come much, much later, what analyzing the study. So the initial part is writing the protocol and getting a sample size. So in that thing, if you put 1% as the level of significance, it is going to give you a large sample size, because to detect a small difference, you will have to analyze more number of people. It is just like power. If you increase the level of power, you have to analyze more number of patients. So again, the problem comes is, suppose if there is a difference, but that difference is giving a probability of around 4%. If you keep it at 1%, you are going to miss that difference, which is actually clinically significant. But since your level of significance is only 1%, you are going to miss it. So, this actually has to, whenever we, try to incorporate or try to formulate a study in the protocol stage, that is what is the idea of reviewing the literature. So when we write a review of literature, it's not just that to read the study, okay, this has 4 studies, so I will do one. There are many things which you have to read in depth, so that you can decide upon this level of significance, this level of the power of the study. So all these studies have to be read in great detail. Then only you should try and formulate your study, decide level of significance and power. So that is how it has to go.
I'll just like to add, Dr. Nitin,
Yes.
in relation to Raghav's question, that like he said, that this is also by convention, because it has been seen that in clinical, medicine is an empirical science. It's not a mathematical science. So you need to have some clinical judgment also. If you make your criteria very stringent, sometimes those criteria are not clinically relevant. That is what Dr. Nitin also added. One is the sample size, which is a practical problem. The second is that such narrow differences, because you will see a natural variation of observations in every patient in every clinical scenario. So there has to be a level of significance which has to cover for that variation. Exactly. And that is what researchers over the years have kept a conventional level 5%. Of significance at 5%. And in circumstances which demand for more stringency, there are studies which take even more stringent.
1%.
That is the idea. That is what we must know.
Yes.
So Dr. Nitin, my personal question to you is, since I'm sure
Yes.
that with so much of knowledge, you must be doing your own analysis. And I dare say that I also try to do the same. So which software do you think that, is for a beginner or somebody who has got a basic grasp? Because, nowadays R is a open source software, and it has a lot of advantages for new researchers. So which software do you think one should venture into, if at all?
Okay, sir, if you are talking about somebody who has just started analyzing and he wants to, do some basic analysis, then nothing better than Excel. Because in Excel, you can do proportion studies and everything. So the basic formulas
and all. You can make very nice drafts also, right.
So Excel is one of the best if that person can go on Excel. Now, if he wants to further try and do certain more mathematical calculations and all, and he wants inbuilt formulas or inbuilt t-test and everything, then SPSS comes next. Now, why SPSS? Because it is there for a very long time. So many of the people are quite well versed with using SPSS. Like I will talk about myself. I prefer SPSS because I learned everything on SPSS, but I am much more comfortable with SPSS as compared to Excel. So I started on SPSS. So I am continuing SPSS for last almost 6-7 years. So it all depends upon the person also, where he's more comfortable. But for a beginner, Excel is the best, then SPSS. And as sir said, R software is now one of the in things. So I am also trying to get a training on R Commander somewhere. Sir just got it.
I think we'll go together. I think we should do that together. Gain a lot from you.
Right, sir.
So Dr. Nitin, thank you for that very educational talk. And we had a good time, and I hope that we'll join it to the other complementary talks and even make it more significant. Thank you very much for all to join us in this.
Thank you for an opportunity.
Thank you.
Thank you for the opportunity. Thank you.